yourself out. Go ahead and pan everybody.
All right. There we go. Got a bunch of people. Okay.
So you think you can nurse? This is how a recruiter for Franciscan Health System opened her information session. And that statement resonated with me because I never thought of it that way. Not every nurse is a good nurse. Not everyone can nurse, and not everyone goes into nursing for the proper reasons. So I had to ask myself, can I nurse? This is a question that's not just answered by working a little bit in the field or by doing some research or even figuring out whether or not you can meet the educational requirements. I think it's a combination of everything. You really have to look really hard within yourself to find out if this selfless profession is something that you can really do. So after great deliberation and a lot of research, and now I'm working on my education, I'm going to answer some questions about what nurses do, how they do it, and what the job outlook is for them. So according to the occupational handbook, nurses implement treatment plans for patients. They treat patients. They find a lot of educational material to help them in their day-to-day life after they go home from the doctor's office, from the hospital. They provide medications for patients, and they also do some education for their families, which is one piece that I think is overlooked. In addition to those daily tasks, nurses have to possess some internal qualities that you really have to find out if this is something that you really can do. Nurses need to be organized. They need to be really good self-managers. They have to be deliberate and methodical. When you're giving medication and when someone's life is in your hands, you really have to think about what this patient is going to need in order to be healthy after this, and then deliberately give them the things that you know are going to help them. Registered nurses are employed in several different areas. They're in hospitals, nursing homes, home health care facilities, and even employment agencies. So now that I've talked a little bit about what nurses do, let's talk about what you need to do to break into this growing field. So there are 3 ways that you can become a nurse. The first one is a diploma. Now those opportunities are usually offered through the hospital, and more than likely they're given to people who are already working as certified nursing assistants or as some form of an emergency room technician. Those opportunities are few and far between, so you have to be really diligent about trying to get into something like that. The other is an ADN, which is an associate's degree nurse. Now that opportunity takes about 2 to 3 years to complete, and is offered at a junior college or community college. And lastly, there's a BSN nurse. This is a Bachelor's of Science in Nursing, and this is offered at usually a college or a university, and it takes about 4 years to complete. Now, becoming a nurse is something that you really have to decide, is it really for me? And because you have people's lives in your hands, this is a question that you really want to think long and hard about before you go into it. As well as you want to think about what the job outlook looks like for whichever opportunity that you decide, whether it be the diploma, the associate's degree, or the bachelor's degree. According to the Occupational Outlook Handbook, the nursing profession is expected to grow much faster than normal, with 5,800 and 500 jobs that are going to become available between 2008 and 2018. Now that's a 22% increase. If you look at that, that's far larger than many other professions. But we are seeing that with the American Association of Colleges of Nurses, people have said that there's no longer this shortage in nursing. They believe that this is largely due to the slowing economy, and that once the economy picks back up and hiring freezes come back off and things like that, nurses will again be in extremely high demand. The salary for nurses is extremely good. In 2008, the average nursing salary was $62,450 a year. That's awesome. The nursing profession needs new nurses. They need nurses to come in at any level and then take their education further to get a master's degree so that they can educate new nurses. With our baby boomers going out, we need new people to come in. With nursing going into everything being electronic, we definitely need new people who've been trained on computers, been working with computers, to come in and be able to flow right into that system. So, after much deliberation, research, and hours of actually working in the nursing field, I found that nursing is for me. I possess the external qualities that I need, as well as the internal qualities that I need in order to become a great nurse. I think that there are 3 major things you have to do to decide where you want to go and which way you want to go in this. The first, take your top 2 or 3 colleges, go and visit them, find out whether or not that culture is for you, because it's not just about the education, it's about what happens there as well. Next, understand really what's going to be asked of you from being a nurse. And lastly, know exactly what this selfless profession is going to cause and how you can truly, truly touch someone's life through what you're doing.
All right. It's just over 5 minutes.
Oh, cool. I didn't practice at all today.